Hi, my name is Dr. David Weinstein. I am one of the directors at the Sunrise Wellness Center. My partner is Dr. Ronald Sinagra. Today I would like to talk to you about headaches, more specifically migraine headaches, cluster headaches, tension headaches. Of course, some people suffer from frontal, suboccipital, and temporal headaches, but the main ones or the main sufferers seem to be the migraine headaches and the cluster headaches. As a child, I was diagnosed with migraine headaches at about 7 or 8 years of age. Back then, the drug of choice was something called Fiorinal. It was a blood thinner. The philosophy or theory was that the headaches were coming from vascular episodes, too much blood rushing to my head. So by giving me a blood thinner, this would help the headaches. The problem was that Fiorinal never worked once the headache came on. So the solution, after years of seeing me go through tons of these Fiorinal blood thinners, was to give me Fioricet, a combination of Fiorinal and Darvocet, Darvocet being a painkiller. So now if I had a headache, I could take something to kill the pain. Obviously, as a child, this was devastating to my health, my performance in life, and it really became a way of life having to deal with these headaches with testing and testing in school and worried about having tests and sports and being able to, do all the things that I wanted to do. And if I had a headache, of course, you couldn't do that. Ultimately, I found an answer to my problem. And I'd like to talk to you about today is how you can help yourself if you suffer from these type of problems. Now, the first thing to understand is that the majority of headaches are vascular in nature. What I mean by that is too much blood is rushing to your head. It's often a sympathetic nervous system response, meaning that something is happening in your body, your fight or flight system, that is raising blood pressure, raising the amount of blood rushing to your head, and this is often why we get particularly the migraine and tension headaches. And there's a variety of reasons that this can happen. As chiropractors, the first thing we always look at is the cervical spine, the neck area. In the neck area is the parasympathetic and sympathetic portions of our nervous system. They're elsewhere in our spine as well, but it seems predominantly in the patients that we take care of that a problem in the neck area can often be related to headaches. For me, this was the answer to my problem, having my neck checked properly by a chiropractor, and once I started to receive chiropractic care, I never received or never got headaches again. Many times patients can have headaches for other reasons besides the spine. What we look at is sympathetic responses from metabolic reasons. What I mean by that is what makes Sunrise Wellness Center different is we have a neurologic and metabolic approach. Neurologically, we look at your spine, particularly the brainstem area where the parasympathetic is. The parasympathetic slows down the sympathetic. Sympathetic is what increases, parasympathetic decreases. But we have to also look at metabolic reasons. And what I mean by that is, let's say for instance you're a high stress person and you have what's called adrenal issues. The adrenal gland is the gland that primarily deals with stress in our body. It's also the antithesis to insulin or the pancreas. When insulin is going high, cortisol goes low, and vice versa. If you're having adrenal stress or adrenal type related issues, the adrenal gland produces cortisol. Cortisol is kind of like our fight or flight syndrome. It's a passing gear, so to speak. What also happens when the adrenal gland is producing cortisol is it often raises aldosterone, epinephrine, and norepinephrine. These things raise blood pressure. When blood pressure is up, again, this can be a cause of why you're having headaches. For us, what we have to do is understand why your adrenal glands are acting inappropriately and try and deal with it through nutritional and supplementation. This is our protocols with all patients, is to help them through neurologic means, meaning chiropractic care, and through nutritional means, meaning supplementation and diet changes. Any type of problem that is causing an increase in blood sugar or high blood pressure can also be the cause of headaches. So again, if you're someone who's overweight or you're eating too many carbohydrates, a typical American diet where your blood pressure is high and your cholesterol is high and your weight is high and blood sugar is high, this can be another reason why you're suffering from headaches. So again, through blood work, we can ascertain what's happening in your body, what foods you may be eating that could be causing you problems, and we can figure out a way to correct this. Thirdly, we look at food allergies. It is very common for us to find patients who are having food allergies, and with these food allergies, they're eating foods that are causing reactions in their body that can be causing headaches, much like any allergy would. And we can test for these things. Thirdly, if you're having food allergies, many times these food allergies can cause damage to the lining of our gut. And this is a major problem that we find with a lot of our headache patients, is that they have what we call systemic inflammation. Systemic inflammation is generally caused from toxins in your body. One of the major reasons we can get toxins in our body is one, from food allergies, or two, from having damage to the lining of our gut. If you're having digestive disorders, that certainly can mean you. And what we would do in that case is figure out why you're having damage to the lining of the gut. As you go through our website, you can see some things on leaky gut or intestinal permeability. If the lining of your gut is damaged from food allergies, bacteria, viruses, mold, yeast, toxins, adrenal stress, cortisol, which also damages the lining of the gut, high blood sugar, which also can damage the lining of the gut, you could end up with leaky gut, meaning that the membranes of the lining of your gut can actually be semi-permeable, and things that are supposed to go through our digestive system come out into our system, creating systemic inflammation. This is a major cause of headaches. Years and years in practice, we always had patients come in and ultimately always felt that chiropractic would be the answer to their headaches, and we recently started to find patients that did better with chiropractic care. But once we started to address their metabolic problems, meaning if they had gut problems, adrenal problems, blood sugar problems, so forth and so on, we were able to get these patients with cluster headaches, tension headaches, migraine headaches better. And what I'd like you to do is canvass our website, go through some of our testimonial pages, and I'm sure you'll find some patients who are suffering as you are. And I'd like you to consider to come into our office and let us do a consultation. During the consultation, we can try and figure out if your problem is neurologic, metabolic, or a combination of both, and then we can tell you how we can help you. The consultation is no charge. We'd like to find out if, one, we can help you, and two, if you'd be a candidate for our program. So feel free to call us. We'd love to answer any questions. Thank you very much.